Appliances with us tonight. Welcome, Kevin, and thanks for coming.
Absolutely. Thanks for having me. This is great.
Sure, it's a pleasure. I mean, we can always usually talk over a beer at this time of night, usually after, of course. So I know
Right.
this is a first for us. But
Yeah.
I would like to give you a formal introduction. Kevin Ohlendorf is the third generation owner of the Ohlendorf Appliance Laboratory, located in St. Louis, Missouri, and services doctors in all 50 states. Kevin has worked full-time at the lab for 25 years, and he has attended thousands of hours of CE courses on a variety of topics, including cephalometrics, orthodontics, growth and development, minor tooth movement, airway, and sleep disorders. So he's basically an expert in all areas of appliance therapy and orthodontics. So welcome. So tonight, I just want to set the stage a little bit. Kevin is actually an integral part of the Airway Health Solutions team. So Airway Health Solutions kicked off a couple of years ago based on Dr. Miraglia's methods of doing expansion. So with children and with adults, I would say from the age with expanders, probably from 8 all the way to 88, so to speak. Right. So tonight we're actually going to be focusing on the expansion appliances itself and any clinical questions. I know I got a lot of them from those who registered, and maybe I'll get some more on Facebook. But I'm excited because we actually set up another conversation just based on clinical cases and research. So that will be with Dr. Ben Miraglia Wednesday, September 30th at 8 p.m. So I encourage you, if you're on Facebook right now, to look on the event page to sign up for that. And if you're with us live on Zoom, I put it in the chat where you can register for that course. And then this way we can kind of set the tone that we're going to be focusing on the appliances themselves, and I can actually touch upon how to implement that from the hygiene chair. Okay, so let's kick this off and really start talking about airway appliances and what Dr. Miraglia has been using for the last 17 years of his practice. And that's how you and I met, through Dr. Miraglia. So maybe just give us a little bit background information about Dr. Miraglia's and your relationship as his main lab.
Sure. So thanks for having me. I really appreciate it. This is a great forum and a great way to kind of share some information real informally and do it in a relaxed atmosphere. We've been working with Dr. Miraglia probably about 8 or 9 years now as his main lab for all of his expansion appliances that he does for the kids and for his adults. And it started, we were doing the appliances for him. We met at some courses over the years and just kind of had a mutual respect and understanding and knowledge base, and just the same philosophy of how children and adults should be treated and what their best options are. And he would ask questions about what other doctors are doing across the country, and I tell him what everybody was doing, type of thing. And it's just been a really good collaboration over the years. And he started teaching. Sorry, I got something popped up here on me.
It's okay.
Started teaching, or wanted to start teaching, and so he asked me if I'd be a part of his programs, since we had been doing his appliances and we knew his techniques so well. And it was just a natural fit. I was super excited and very honored that he would choose us to do that for him. And we've been with him and doing courses and all kinds of things with him for a number of years now. It's been great. It really has been wonderful.
And we couldn't do our Airway Health Solutions mini residencies without you, because it's an integral component to what we are teaching. So if you want any information about the actual mini residency where you too can learn how to implement these airway appliances, please visit our website. It's pretty easy. It's www.airwayhealthsolutions.com. You can do /events. I'll post the link in the comments as well and at the end of the presentation. But let's get back to you, Kevin, because you have such a broad knowledge of these appliances. I mean, you live and breathe them. It's literally in your blood. You're, what you said, third generation. So, you know, maybe just talk a little bit about how you got interested in this as a kid, that you decided to take over your family's business as well.
Right. So my grandfather started the lab in 1933, and we've always been based out of St. Louis. And we've done just about everything and seen just about everything. People ask about, oh, this new appliance has come out, or this one, and we've got incredible archives that go back all the way into the 30s that showed, the origination of a lot of these different appliances and how they work. And I always tell everybody I could fill tables filled with expansion appliances, all the different designs and every different variation that dentists have come out with over the years. We've seen and made and worked with a lot of them on developing them. So we, really have had a hands-on frontline approach and seen how a lot of these work. And what that's allowed us to do is really hone down on a few appliances that are really the easiest and the best to work with. They give the best results for the patients. They give the best repeatable results. And it's just consistent year after year, the type of results and things you can expect from them with all the different patients that you see. Some appliances are made and they work real specific for certain patients in very specific cases. And the ones that we try to talk about, I know that Dr. Miraglia teaches, are ones that work for a broad group of patients. So you really kind of take the whole mystery of what appliances are all about and how they work out of the equation. Because if you go to different courses and you hear different people speak, they'll show you 15 different fixed upper expansion appliances to use and tell you why this is when you use this and this is how you do that. And Dr. Miraglia has done a great job of really focusing down on one or two appliances that work great to really give you the results you need and simplify it so you're not lost in the whole world of appliances, which is not hard to do.
Right, it's that rabbit hole, right?
Exactly, that's right. And we see it happen all the time with doctors. They'll go to a course, they'll get real excited about it, they'll want to start doing some cases, they'll try some different types of appliances and may get frustrated with them because they don't understand how they all work and what's the best way to really use them, and they get frustrated with them and they end up leaving and not doing any of them, just a few and that's it. So that's why it's really nice to work with Airway Health Solutions, because they really help you to adapt and integrate the whole thing into your practice so you can carry it on beyond just a couple cases to try to see what it's all about.
Yeah, and that's what we pride ourselves on, is that we make it implementable really on Monday morning. But we also encourage you to learn, other appliances as well, different portfolios, so you have that to your bag. We are not against other appliances, but we just try to simplify it to help the most people that we can in a simple way. A lot of doctors use this as a starting base, but a lot of doctors have taken advanced courses and actually have taken our course and implement what they've learned from our course. So let's get to these appliances, because we're going to show the appliances that Dr. Miraglia teaches in the course. And the best way to do that is to literally show the appliances. So let me go ahead and go to the pictures here.
You're doing great with the technical stuff here.
Oh, you just cursed me.
Yeah.
I think so. Hold on 1 second.
I knocked on wood and
that
everything.
Just way too soon.
I knocked on wood way before I said it.
Yeah, just don't give me the. Okay, from current slide. Let's see. Okay, there we go. So this is the super screw expander, and we're going to start with children and then go to the adults. So tell us, Kevin, about the super screw expander.
Sure. So everybody's familiar with a rapid palatal expander or a Hyrax expander, and this is a little bit of a variation of that type of expander. The only thing that's really different is the screw mechanism that's used to do the expansion. And this is called a super screw. It's been around for a number of years, and some doctors love it and they have used it, for a long time, but it just doesn't. It's just kind of one of those things, unless you've actually been exposed to it and see how it works, you don't necessarily use it. The thing that Dr. Miraglia really likes about it the most is it's very easy to adjust. And so instead of having to take a little blue handled key and try to find the hole to make the expansion on a regular rapid palatal expander, this expander's got a nice big barrel and a big wrench that's used to turn and activate the appliance. So it's really easy for the patients and the parents to activate it. And it's interesting, everybody that's tried this, that has done rapid palatal expansion screws in the past, they never go back to rapid palatal expanders. So I don't, it's just one of those things where you try to tell people about it and say, hey, this is a great way to do it. And they'll say, oh, I'm just used to the rapid palatal expander. I'm just going to go with that. But when you teach and learn this one, it really is a great modification and makes it really simple for the patients and the parents to activate it. It's a couple little modifications Dr. Miraglia does. He doesn't put any bands on the first deciduous molars or any type of rests, but he does place a little composite ledge where those purple dots are on the lingual, and that helps hold the appliance down and creates a little retention point for them, so the appliance won't ride up as it's being activated, but it'll still let the appliance do its expansion without getting caught up with the composite. So that composite's not placed over the top of the wire, it's just a little bit above like a shelf so that the wires are still free to move back and forth, but it allows the appliance to stay down and seated where it needs to be. And then he also has the anterior finger springs that are always standard on this appliance as well. And that just kind of works to start rounding out those anteriors, getting them in a little bit better position. It'll even start to straighten them out a little bit. Just sitting there as they are, they'll do a little bit, but if you start to activate them a little bit, you can actually get some flaring of the teeth and start getting them to straighten out. It's really a really good versatile appliance. And you can use it for a couple different things or one specific thing. It just depends on how you activate it and what you want to do with it. But it really will do a great job for it.
What age group or the range would you say this would be appropriate for?
So about the earliest that you want to start with these is, and chronological age is not always the best way to determine these. It's more dental age. So what we would normally recommend is you don't want to start anybody until the first molars have erupted enough that the full crown is erupted. So we don't necessarily have to band them, but you want to be able to see them all the way. And then what that allows is that when the expansion occurs, the first molars are picked up in the expansion and the whole arch develops. We sometimes make expanders on younger patients where the first molars haven't erupted at all. And you run into the risk sometimes where those molars will actually erupt to the lingual a little bit, and you have to come back in with a second expander and expand just the molars because the rest of the arch is already expanded out. So recommend really you're going to start right about when that those first molars have erupted. You can see them and get a good band fit on them. And you'll do that for this appliance. Dr. Miraglia does this pretty much into the like 15, 16-year-old range is about the max that he'll go with this expander with it.
And the earliest, would you say? Do you know? We can ask him on the 30th, but.
Exactly, yeah. But that's kind of the as far as from the lab perspective, that's what we see is good. Yep.
Perfect. So let's go to the screw that open.
Yep, so as you can see, what's also nice about the super screw is as it opens up, you can actually see how much activation has occurred. So if you look on the right-hand side of the screw, you can see some little lines that are in the actual housing. Those are in 2 millimeter increments. So you can measure those and get a feel for how much the screw has been expanded. On the left side over there, you can see the threads and another little nut. And that nut is a locking nut. And so when it expands out a little bit, you can go in and turn that locking nut all the way up against the housing, and then that'll prevent the screw from backing up. So with a regular rapid palatal expander, you don't have that option. You have to actually either tie it or fill it with composite if you're worried about the screw backing up later on. But this has this locking nut built into it, and the lines on there to be able to tell how much activation has occurred. So there really is a lot of little benefits to this screw over the standard old rapid palatal expander.
Great, well, it's great to see that view.
Yeah, and you can also see how the anterior finger springs will need to be adjusted as you go along. They're made at the beginning to just fit the arch, but you're gonna wanna bend those wires straight so that they're not interfering with the tongue as they go along. And it's a real simple bend. Just get in there with the 3-prong, just bend them out of the way, get them straightened up so they're not bothering the patient. And then this shows how you can turn that screw up against the housing to prevent it, the locking screw, to prevent the screw from backing up as you go. So it really does a nice job of retention and holding the expansion after you've done it.
Okay, so let's go to the lower fixed Schwartz.
Right, this is the lower fixed one. Unfortunately, there's not a super screw type mechanism for the lower arch, just for the upper. And so we're gonna go with just the standard expansion screw on the lower arch. And you can see there's a little hole in the anterior and an arrow. It's kind of tough to see from that picture, but the little arrow there. And the patient puts the blue handled key that we send along with it in that hole, pushes it back towards the back of the mouth to rotate the screw until it stops and the screw for next adjustment is visible. And that's a turn and that activates it. So it's ready to go. And we also always put lingual finger springs on these as well for the same reason we do it on the upper, so that you can start to kind of flare those anteriors forward a little bit and you can get some alignment as well.
Perfect.
This is a little different modification of that fixed Schwartz, where sometimes those first molars haven't erupted enough to band. And so we'll put bands on the second deciduous molars, excuse me, second deciduous molars, and then put some little extension wires back to engage the first molar so it'll expand out the first molars as the arch is expanded. And we always like this model because it's really representative of what you see of a lower constricted arch in that early mixed dentition era, where the anteriors are all jumbled up, the upper arch is constricted, it's got the lower arch constricted, and this appliance does a great job of just uprighting those posterior teeth and creating the space you need for the anteriors and allow the lower arch to keep up with the expansion on the upper arch.
Great. Okay, so the two screw expander.
All right, I'm choking tonight. I don't know what I'm.
No, that's
really
okay.
it'll help me.
Take your time.
There we
I'm
go.
familiar with this.
Yeah, I bet you are. I know you are. Firsthand knowledge.
Yes.
So for the adult patients and your pre-Invisalign cases where you've got narrow arches, your mid to late teens, and your adults, this is the appliance Dr. Miraglia likes to use the most. It's a two screw expander. It has occlusal coverage for good retention and also to really help get that whole arch to develop out nicely. We also make a little other modification when we make this appliance that's very unique. And we actually block out the palate so that as the arch is expanded, there's room for the palate to start to drop a little bit. Because a lot of times in these cases where you've got constricted upper arches in adults and older teens, that palate is really high because they've been mouth breathing and all kinds of stuff. And so this allows the palate to start to drop to help open up the airway a little bit as it goes along. We also place the screws down away from the acrylic a little bit so you can even go in and adjust the acrylic on the palate as you go too in order to get it to drop even further if you need to. This is a real slow expansion appliance. That's it right there. That's it.
I have it. So
Yeah.
I can share with a little bit my experience as an adult using this and as a hygienist.
Oh yeah.
Is that I found it super comfortable, which I was shocked. I wore aligners. I did a couple of brands of them, and just from my dental alveolar ridge, it always seemed to cut. I didn't use your aligners yet, though, Kevin. So, so I'm going to try them after this.
Right.
But I found it really conducive to my schedule working from home. I could see it maybe a little difficult for those patients who are talking or speaking like a teacher, but it's doable. Now that I felt the sensation of when it's tight, when it's not, kind of what you can get away with, what you can't get away with, you really could use this throughout work as long as you wear it, 2 hours in the morning at some point in time, a little bit at lunchtime, a couple of hours in the afternoon, in the evening, and then when you sleep with it. So, so far so good. I'm excited to share my journey. I actually have a YouTube channel, Airway Health Solutions, going over my journey. So there's some tricks and tips for patients. So it's very patient friendly. I did that on purpose. So you can use my videos as a resource for patient education. So I'm excited for that. And we'll watch my progress for sure.
Yeah, it's exciting. It's amazing
right?
how
You
much.
said I was probably the most excited person to get these expanders, right? Knowing the
Absolutely.
benefits of it all, I was like, it was like Christmas morning when they came.
Right.
Okay, so let's go to the lower removable expander.
Yep. And so this is the lower expander. And there's been some questions about this that we've had at the lab recently about it. Dr. Miraglia does use these occasionally. If there's cases where he's not going to use Invisalign, then he'll use this lower expander to really try to just upright those lower posteriors to try to get some better arch form and just get things rounded out a little bit better and to keep up with the development of the upper arch. If you know you're going to Invisalign, you can sometimes skip having the lower expander because Invisalign does do a good job of uprighting those posterior teeth. But this is a good way to control it and to keep everything kind of going in the same direction. When you start expanding one arch and not the other, you run the risk of the occlusion getting out of whack and things just not in balance the whole way. And with adults especially, that can be a little bit more difficult for them to adapt to. So if they got an upper arch that's real wide and the lower arch that's condensed and constricted that hasn't caught up yet to the expansion on the upper, it can sometimes, be a little bit difficult for them to tolerate. And so this is an easy way to do it. And this lower is really easy, as you can attest to wear.
Yeah,
There's
absolutely. I find that easy. And I was concerned because I thought they were going to be bulky, having two appliances in the mouth at the same time. But you
Right.
really can't speak with them anyway. That's one drawback. So that's why you can't wear them while you're working if you're a teacher. But so I find it's not a big deal to wear them together, especially when I'm sleeping. It's
Sure.
comfortable.
Right.
So the other thing is I find it could be a more affordable option. So you don't have to have a full Invisalign or any type of aligner case fee, that it may be more affordable. You can maybe do more for perhaps patients who can afford a big type of lab fee or large case like that, a comprehensive case.
So even with the expansion appliances, one of the doctors that we've followed for years uses a really good example of them or analogy of them, that appliances are like bulldozers. They come in and they do big movements. They develop out arches, they create lots of space. And then your Invisalign can act like picks and shovels to come in and just kind of clean things up, get things aligned and everything leveled out to where they need to be. If you try to use Invisalign to be the bulldozer, it can sometimes really lead to a long, drawn-out treatment. But these appliances can really help to get things moving along and really make nice big movements for you and jump you way ahead, and then kind of take your time and get everything lined up and straightened up with Invisalign or MyoBrace or something like that.
Terrific. Yeah, so there's plenty of options. Really, there's no really one way to do it. I feel like it's nice to have a different portfolio depending on the patient, depending on your experience, depending, on a lot of key factors.
Exactly. And we're there to really help everybody out. So if you have questions about these and the sequencing and the timing of this, please give us a call and we're more than happy to talk to you. We do free technical support at the lab. It's probably easiest to reach me by email, so you can email me some pictures and I'll respond to them that way. Or, try to call, it just depends. I'm running the lab, so I'm trying to do as many calls as I can, but sometimes it gets a little hectic. But Al at our lab can also, he's been to Dr. Miraglia's courses as well. So he knows the technique and he can help you with your questions. And we can answer different questions about all the different appliances that are out there, the pros and cons, and work with sequencing for you and special designs if you need it. So we're really there to do as much hand holding as we can. And we understand, when you're just starting out with these appliances, there's a lot of questions, there's a lot of unknowns, and we want to make sure that we're there to answer those for you.
Yeah, you guys are terrific at that. I do get a common question about the lower removable expander, and that is exactly how much expansion can you expect to get? And is there any type of actual expansion, or is it just all tipping?
Most of it's tipping. You're going to get, 90% of it is tipping because of the bone. And, Dr. Miraglia can talk more about that.
Right.
And he'd be better to talk more about that than I would. But
okay.
It's a lot of tipping for the most part because the bone doesn't remodel like on the lower jaw like it does on the upper. And so the removable screws are 8 millimeters. Each turn is a 1/4 millimeter. but you don't necessarily get 1 millimeter of activation doesn't equal 1 millimeter of development.
Okay.
So we normally see about anywhere between 4 to 6 millimeters of development or uprighting per appliance like this.
Okay.
And usually that's about the most you really will need. If you need more than that, it's pretty rare you need 2. But you know,
Would that be the same on the upper? How much expansion? I'll just go back. How much expansion can you expect to get with a 2-screw expander?
It's still the same. So the reason there's 2 screws is because the patient's an adult most of the time, and it just prevents, 1 screw is not strong enough to hold and give the development and push that's needed. So we put 2 screws in there for added strength and to prevent the arch from being able to back up. So there's still 8 millimeter screws, but you'll probably get more like 5 to 7 millimeters of expansion in the upper arch, just because you're able to remodel the bone a little bit better and a little bit better development. Again, the estimates of expansion are right on. Why they occur, that's a good Dr. Miraglia question.
Okay, excellent. So we have one more expanded that we recommend during our mini residency, and that's the 3-screw sagittal. Tell us a little bit about that.
Sure. In some cases, you're going to have just the arch is constricted, just needs to be expanded out, and that transverse works great. If you want to try to get some AP development, some anterior push on it as well, then this 3-screw sagittal works great for that. So you're going to get your expansion, and then the sagittal screws in the front will work to either flare the anteriors forward, develop the premaxilla forward, or both. And so you can get a lot of different movement, a little bit of AP development, as well as arch width. And a lot of these patients need all the space they can get for their tongue, and the more space they have, the better chance they're going to be able to breathe through their nose, and the more volume they have, just the better it's going to be. And so it'll really help to go both transversely and anteriorly as much as possible.
Terrific. So let's open this up to questions. I'm going to stop sharing here so we can see if anyone has a question on Zoom, if you want to type it in the chat box. But we already have some questions that when people signed up, they had answered. So how can they do adult aligners through your lab? That was one of the questions. Start with that.
Yeah, so we have 2 different products. Our whole aligners are called our Clear Solutions, and we have a real simple one called Clear Express, and it's for just the 4 anterior teeth, upper and lower, and it's a pay per tray system. So if the patient just has 1 tooth that's a little bit out of alignment, we can make 1 tray that'll align them for it, or that'll line it up for them. And we normally with the Clear Express go between like 1 and 6 trays. When you start getting out to 6 or more trays, then we'll move you to what is called our Clear Force, and that's our full arch comprehensive aligner system. And it averages anywhere between like 12 to 18 trays per arch, but it's moving all the teeth, doing a really good job of alignment, little bit of arch width development and expansion as it goes along. So where the Express is just straightening out the anteriors and you're getting space by flaring and IPR, the Clear Force is flaring, expansion, and a little bit of IPR. So we've got 2 different products, just depending on how much is needed for the case. We try not to get much more than about 20 trays per arch. If you get up above that amount, then we'll probably call and recommend that you maybe do an appliance first and then come in and finish with aligners like we talked about earlier. We're not Invisalign, we're not in the 40 tray per arch business at all. But some of those really simple cases can be done really economically and quick and easy with our systems. And we can walk you through and let you know which system is best for the individual case depending on the patient's needs, and give you estimates and all kinds of stuff before we get started.
So for my case, Kevin, for example, I'd probably be a great candidate to just tweak with your aligners, right? Because I'm getting the bulk of my transverse expansion with the 2-screw appliance, and then just minor tweaking.
Right.
What material do you use for the aligners?
So all of the material, whether it's Clear Express or Clear Force, is done with Zendura material. and that's the best stuff out there. It's
Okay.
what Invisalign used originally before they came up with their own proprietary material, and so it's the gold standard. And we've tried every material under the sun, and it's definitely not the cheapest. So we know that this works the best, and it's the best, gives the best results for sure.
Well, maybe we'll do another Facebook Live with my aligner experience, right?
That's right.
See how that goes.
Absolutely, start to finish.
Okay, exactly. Okay, they want to know, are these removable airway appliances, are they epigenetic appliances?
They are not. And so they work similar to what the epigenetics is. And I know Dr. Singh, and I've listened to him lecture many times. I've read his book. You know, I'm really familiar with it. Those appliances are very specific and do very specific things. The appliances that we have are airway development appliances, and they're going to do probably 85% of what the epigenetic appliances do without all the expense of them.
Okay, so and I'll rephrase that question also. We'll actually ask the same question to Dr. Miraglia and see his perspective on that as well. What is the recommended frequency and quantity of turns used for a palatal expander? That's from a pedodontist. So let's start with pedo first.
Sure. So the fixed super screw expander is one turn once a day. And the way they do it is they open up as wide as they can. They put the wrench in up by the upper anteriors and then turn it down to the lower anteriors. And that's one activation, and it's done one time per day.
Okay. And the adults?
The adults is one turn per week. So you're going to turn the screw one turn about per week. Yep.
I think Dr. Miraglia was kind because he told me every 2 weeks, and maybe he just wanted to get me started first and make sure I was compliant. But now I can see every week. What I found, just from my own experience and from Dr. Miraglia's recommendation, is you don't need to do the full turn in one day. So it's just a little heads up, a little tidbit where sometimes it could be uncomfortable if you do the whole turn in one day. So you can actually do a quarter turn or a half a turn and spread it out over a couple of days.
Absolutely.
So that was just that was a little helpful. And also, if you turn it, you know, before you go to bed, it's an easier adjustment than doing it in the day and then, you know, going through a couple of hours without wearing it.
Yeah. And you weren't sore. You weren't sore after turning it or anything, were you?
No, I'm not sore about it, but it's interesting because it's just that pressure. So I'd rather not think about it.
Sure.
You know, so it's similar to the aligner feeling. It's really not that much different. It was just that pressure. It's not pain, but you're aware of it, which is actually a good feeling because it means I'm doing my job and this is I'm expanding. So that's the whole point of it. So it's actually reassuring when it's tight at first. And then it's also reassuring when it's not anymore. You know?
Yeah, right.
So that's the whole goal.
You know, with those removables with the adults, that screw's only activated 1/4 millimeter. And so there's no way you could ever, you know, burn the roots out or anything like that. We get those questions every once in a while. It's so slow and gentle. You know, you really are safe with them.
Terrific. And somebody wants to know, Dr. Chan, do you have a manual for all of the TMD and sleep disorder appliances? Do you have a one-stop shop where they can go and see some type of manual on your website?
Well, we are in the process of redoing our website now, and updating a lot of those. If you email me, I can send you a bunch of literature and information and things that we have on not only the sleep appliances, but the expansion appliances and some other stuff as well. So if you just want to email me, then I can get all that to you. Absolutely.
Sure. And then the rest of the questions I received were really better questions for Dr. Miraglia. So hopefully if you're listening or if you're listening to the recorded version and you didn't hear your question, we're not ignoring you. It's just more appropriate for Dr. Miraglia to answer. So hopefully you can join us by clicking on the link either in the chat or on the Facebook chat as well. Somebody wanted to know how they can incorporate this, a hygienist, Chrissy, how she can incorporate this into the service into their practice. So that's a perfect tee off for me to talk about our mini residency that we offer. We actually have one coming up on Friday. This Friday is the pedo portion where we review myofunctional appliances, we review the myobrace, as well as the fixed expanders. We go through the consultation, the how-to, the billing. We give you all of the tools you need to get rolling on Monday morning, and we demystify the whole expansion journey for you. And we divided it into 2 days. It used to be only a 2-day mini residency. Now you can take it just the pedo if you want, or just the adult, but we do recommend taking 2 days because it's adult dentition and primary dentition. So
right.
Even if you're a pedodontist, you see teenagers with adult dentition. So it's nice to have that full spectrum to really implement this into your practice. And then we also do team training at Airway Health Solutions. I'm a hygienist. I see clinically patients, and if I see 8 patients a day, I'm literally having 8 conversations a day about airway. And we can teach how to relate common things such as cold sensitivity all the way to airway to create patient value. So they're on board with getting the appliances that you've learned how to incorporate. So those are all the questions I have. Kevin, did you want to anything? Oh, wait. I have one more question on Facebook here. Would you recommend some pediatric AP growth appliance without distalizing the molars? That would be the appliance that Dr. Miraglia uses, correct?
Right. Yeah, we have some 3-screw fixed pedo appliances for expansion and AP development, and I can get you some information on those designs, but a lot of times those kids at that age, they need a little AP development too. And there are some definite good appliances for that as well. Perfect. We could do that in our next one, right? We could talk about those.
Absolutely. Absolutely. So those are all the questions we have for you. And I think that I hope everyone tunes in on September 30th because we can continue this discussion. There's a lot to still talk about, but we really hope that this was helpful, that you enjoyed at least seeing the appliances. Thank you, Kevin, for sharing your knowledge. It was very helpful and very informative. I'm sure many people appreciate it out there. And this will be recorded as well. So if you missed any part of it, you can see it in its entirety. And the contact information, I'm going to go ahead and share my screen so anyone can kind of take a picture of that. Here is our upcoming mini residencies. Okay, it's going to be September. We have other mini residency in November. These are all online. It's considered live CE. We do have live Q&A, live case reviews. So please contact me or go to our website to learn more about that. And then here is our contact information to learn more about Airway Health Solutions and our services. We also do coaching services. And of course, Kevin, who is a wonderful, wonderful resource to any dentist or orthodontist out there. Please, please, please contact Kevin. He'll make your life easy. Any closing remarks, Kevin?
I just really appreciate the opportunity. This is great to be able to share this information and in a great format. Like I said, these are really neat to do. We were talking before we started a year ago, we would have never thought we would have been doing these types of things, but here we are, and it's really a neat way to do some different things. And
okay, so we'll have a virtual cheers together, a virtual beer, which we usually have after our courses. And have a good night, everyone. Kevin will have you back on to talk about more things another time. Okay.
I appreciate it. Thank you.
Thanks. Good night, everybody. Bye-bye.
Bye.